Thank you. And now, with no further delay, I would like to invite Dr. Priya Chokalingam to take over the webinar with a topic Heart Health Updates.
Good evening, one and all. It's a great pleasure, an immense pleasure to join with all of you this evening. I'm really thankful to Dr. Nappin Isairan for joining hands with us. It's amazing to see that in the midst of this pandemic, we are still able to be connected. And you've all taken your time out on a Saturday evening to learn more about heart health and emotional well-being, and what are some important tips that each and every one of us can follow during this crucial period in our lives. So the global health trends, if we look at how it is today, currently, we are at the crossroads of two big groups of diseases. One is the infectious diseases or the communicable diseases, and the other is the group called the lifestyle diseases or the non-communicable diseases. So in the recent past, we had at least believed that we had conquered most of the infections, and it was the lifestyle diseases such as heart attack, stroke, hypertension, diabetes, obesity, all of these which are the biggest threat to our health and wellness all over the world, particularly in our country. However, the COVID-19 pandemic came just out of the blue. And for instance, if you look at the, below the graph here, we know that about 50 crore people globally are affected with cardiovascular diseases. So when we say CVD, we refer to cardiovascular diseases, that is diseases of the heart and blood vessels. The most, the biggest killer of that being heart attack. And actually, there are over 2 crore people dying annually from these cardiovascular diseases all over the world. So this is an ongoing pandemic of some sort, if you would like to call it, and which we are actually, creating more awareness about and getting people to prevent and deal with these cardiovascular diseases. And as I said, the COVID-19 pandemic, the SARS-CoV-2 virus has been a big threat for the last 1.5 years. So we have currently seen that over 17 crore people are affected with the virus globally, and just over 37 lakh people have lost their lives to this infection. So what is the thing that we have to do to prevent disease, both types of diseases? How are we going to go ahead and make sure that we and our future generations are going to be healthy? So that is going to be the main crux of today's talk. So as I said, heart diseases are the #1 killer diseases worldwide. There's no doubt in that. In both men and women, they are the leading cause of death. So one big tool that we have now is the vaccine against the virus itself. So we will be talking about that in a little bit more detail. So we all know that we are safer at home. So basically not to head out of the house without any urgent work, to practice good hand hygiene, to work remotely whenever possible. So we've all realized that work from home is possible these days. Definitely the social distancing or the physical distancing is very important. Appropriate and adequate masking and disinfection. So all of these play a very important role and will continue to play a very important role for the next few months. So we should not let our guards down when it comes to this threatening virus. People with prior medical conditions have to take definitely these 3 important steps. They have to take all their medications as prescribed during these pandemic times. They have to vaccinate themselves at the earliest with whichever vaccine is available at their local place of residence. And they have to seek timely medical help if the need arises. So, but the bottom line is there is no contraindication for this vaccination unless there is somebody who has had very severe allergies or anaphylaxis in the past. Even then, they are expected to let the healthcare professionals know that they have this condition and then to receive the vaccination. So almost all medical conditions, the individuals should go ahead and get the vaccination at the earliest. And as I said, there are a lot of myths about the vaccination which are floating around. Social media is in a way a wonderful tool, but it also has been instrumental in spreading these kind of myths and false information. So please find out from your healthcare professional or from the vaccine team whether you are eligible, and please try and get the vaccine at the earliest. So COVID and our overall health, if you see, it affects almost all the organs in our body. For instance, cardiovascular diseases, that is heart diseases, people who have prior heart conditions, who have diabetes, any chronic kidney disease, all of them are more prone to a severe form of the virus if they get the infection itself. That we already knew. So people with comorbid conditions or coexisting medical conditions, their risk of succumbing to the infection was higher. However, what now we are seeing is that the COVID infection is not restricted to the lungs alone. It can have impact on the heart, on the kidneys, on the liver, and it can even induce diabetes in people who were non-diabetic prior to the infection. And it could affect our brain, eyes, the reproductive organs, etc. So it has almost every organ that we see that it is affecting. And importantly, we also have to mention the impact that it has on our mental and emotional health. So it's not just the physical health that it affects, but it's also the mental health. So I think we're going to talk about that in more detail as well. So if you ask us how COVID-19 affects the heart, it has both a direct and an indirect effect on the heart. So direct way is actually the virus entering the heart cells or the myocardial cells and causing direct damage. The indirect way is through the inflammatory process. So the inflammation is a process which starts when our body is attacked by a virus or any foreign particle. So these inflammatory cells can cause a lot of damage to almost all organs in the body. So when you take the heart, it can cause heart attack, stroke, coming to the brain, and also it can increase the risk for blood clots all over the body. So this is the way the COVID-19 affects our heart directly and indirectly. And many of you would have had a chance to know about the risk factors for heart diseases earlier itself, but there are 9 risk factors for cardiovascular diseases. So if you see the top row, it is primarily the way we lead our lives, our lifestyle. Unhealthy diet, inadequate exercise, and overweight and obesity. So these are 3 important lifestyle related risk factors. In the second row, we have the use of any kind of tobacco products and even active or passive smoking. We have mental stress or psychosocial risk factors right in the middle, and that is for a very important reason. We have excessive use of alcohol here. So even these are considered lifestyle or choices and behaviors. And in the bottom row, we have the 3 important silent killers: high BP, high sugar, and abnormal cholesterol or dyslipidemia. So these 3 are called silent killers because most of us do not know we have either hypertension or diabetes or cholesterol problems unless and until we get ourselves checked through with a doctor or a routine examination, right? So all these 9 risk factors independently and individually, each one of them is an important risk factor for heart problems. And when we see an individual with 3 or 4 risk factors coinciding or coexisting in the same person, then the risk for a heart problem triples, and the magnitude actually multiplies. So we have to be very cautious about keeping all these risk factors under control. And why did I say psychosocial risk factors is very important and right in the middle? Because chronic stress or any kind of psychosocial factor that is not addressed or managed appropriately can lead to all the other risk factors and thereby become a nidus for a sudden fatal event like a massive heart attack. Right. So what happened during the coronavirus when it struck us and we suddenly went into a lockdown situation? It became very difficult for people to maintain their healthy lifestyle. Stress became a big part of their lives, and they, began resorting to unhealthy forms of stress management, and they were not able to keep their blood pressure, blood sugar, and cholesterol under control due to various reasons. So it was not easy to approach a healthcare facility. It was not easy to take regular tests and be on top of all our parameters. So all of this took a big hit when the restrictions due to the coronavirus hit us. And what is this new phenomenon called long COVID? It is also called the post-COVID syndrome. And this is something which is real. So earlier on last year, we were just gathering initial data about something called the long COVID. Basically, it means that the first 4 weeks when somebody has had been tested positive for COVID, for a 4 week period, they could have the acute symptoms of the infection. They could take time to recover from that acute infection, but any symptom or complication that lingers on after 4 weeks, then that category, it falls under the category of post-COVID syndrome or long COVID. And what are the most common symptoms we see here? If you look, about more than half the population who are recovered from COVID have prolonging fatigue. They can have fatigue, basically means tiredness, listlessness, not able to do everything energetically. They could have joint pains. They could have lingering cough. Definitely chest pain is an important part of the long COVID, and they could have breathlessness. So they will feel short of breath when they're doing their regular activities also. So these things have to be recognized, and it is a condition that needs to be treated. And it is interesting to note that people aged 35 to 49, so people in their prime of their lives, are the ones who are actually reporting the maximum incidence of this long COVID or the post-COVID syndrome. It's interesting because those are the people who want to get back to their work as quickly as possible, who want to be extremely productive, and it is this continuing symptoms which is causing them a lot of uh, slowing them down as well. So the red flag symptoms, or the things that you should be aware of, is severe cough or breathlessness that lingers on or comes up suddenly. Any severe chest pain, okay, that is not something that you should brush aside. Any palpitation, that is abnormal feeling of a heartbeat, either too fast a heartbeat, or you feel that your heart is beating, you can feel your heartbeat. That is not a usual feeling, so that should be evaluated. Any swelling of your feet, all of these should be evaluated through your doctor without further delay, and they will decide, your medical team will decide of whether you need to go ahead with certain blood tests, whether an X-ray or CT chest or ECG, echo, even angiogram. If any of this is indicated, then they will request you or advise you to go ahead with these tests. So what is post-COVID rehab? It is an evidence-based, multidisciplinary and comprehensive intervention for people who are recovering from COVID-19. And it is designed to reduce their symptoms and to stabilize and reverse the disease at the earliest. So definitely it will help to regain the comfortable breathing. Okay, so breathing difficulty, muscle weakness, limited movement, mental fatigue, physical fatigue, all of this, since they are part of the post-COVID syndrome, we have to help break the cycle, and that we do with the help of breathing exercises, aerobics, gradually progressing with your exercise regime. Of course, dietary guidance is very important. Stress management is part of this, and we set simple goals and help you achieve them. And this is done with the help of the doctor's supervision and your vitals being monitored. So as I said, goal setting, medical goal setting or health goal setting is a very important part of any rehabilitation or lifestyle modification program. So we call this the SMART goals, that is specific, measurable, attainable, relevant, and time-bound goals. So these are very important when it comes to health goals as well. So baby steps, we can never emphasize the need for small steps. The importance of small steps are, just crucial when you're trying to make a big change in your health-related lifestyle and in all your clinical parameters. So in short, the secret to a good health is exercising regularly, eating a balanced, healthy diet, prioritizing emotional health and well-being, and avoiding tobacco and alcohol. So I would like to thank you very much for your patient listening. And before I end, let me, remind you that we have to focus on prevention of these diseases. We have to have a purpose, be purposeful, because this pandemic is going to end. And what is the purpose that you would like to achieve? Start planning for that now and start prioritizing. I would say all the things that you would like to have in your life. So I'm sure health is going to be one of the important things that you would prioritize. And I think when we do all of this, peace of mind will naturally come to us. But we have an expert with us, Dr. Napinai Seren, who's going to throw more light on how we can be peaceful even in the midst of these turbulent times.